Now, let's talk about, I mean, I suppose this does play into a kind of disconnect between the political elite who govern us and what we would like them to do. So the infected blood scandal, absolutely disgraceful saga. Now, my question about it, this story emerged at the weekend. First of all, the Health Secretary, Victoria Atkins, to her credit, apparently exploded in fury about all this and says, I want to know why this was covered up. I want an investigation. She has ordered an official investigation into the NHS and its tendency to cover up scandals, its tendency to try to keep secrets from the public who pay for it. So she's got all that going on. But my question to you, we all know about this. They're saying, oh, we've got £10 billion to pay out to the victims. Some of them may be getting £3 million by the summer. I hope they all get the money they deserve. They have no confidence that the government will do this because, after all, the infected blood scandal has been going on for 54 years. So let's not get too excited about this sudden sort of flurry of activity. Perhaps they need another TV drama to inspire them into action, like the one about the post office, but who knows. But anyway, what I would like to ask you, let's park it, that it's a scandal, it's a disgrace. The bloody NHS tried to cover it up. How dare they? Who are these people, I want to know? Who are the people who covered it up and put them in the damn dock? Feel their collars, arrest them and show us that you're going to make amends for this. And while we're at it, how about stripping that old dinosaur, Ken Clarke, of his peerage after the leader of the chief of the public inquiry, Sir Brian Langstaff, and these people, Brian Langstaff, absolute pillar of the establishment. He didn't say this lightly. He slammed Clarke for his blasé, argumentative, unfairly dismissive and disparaging attitude towards the victim. Ken Clarke was the Health Secretary under Margaret Thatcher from 1988 to 1990. He was blasé and dismissive about the fact that 30,000 people were dying because they'd been given infected bad blood, and he was the Health Secretary. Take his peerage away. Let's do something. Let's punish someone for what happened. How about that?
Yeah, completely agree. It's absolutely outrageous, this, and it's been going on for so long. There's too many cover-ups. I mean, it was like Hillsborough is another example as well. Far too many people involved who are basically looking after their own interests and burying, basically, justice.
Post office, of course. Post office, of course.
Yeah, and so compensation is number one, but secondly, there has to be accountability and there has to be a full investigation. I agree with you. Strip people from their positions who have been involved in this. You know, if it's not criminal proceedings, then you can do other things as well. You can get rid of titles, you can get rid of pensions, you can get all kinds of things. I mean, there's two aspects here. It's bad governance in terms of national government, but it's also, as you touched on, the NHS. Now, I'm a big supporter of the NHS frontline staff. You know, that's not the issue here. They're working under horrendous circumstances a lot of time, long hours and bad pay. The issue is about management and structures of the NHS. And I had talked about an immigration. It's about time we actually had a grown-up conversation about this isn't working. It's not fit for purpose. I read today, for instance, kind of going slightly aside here, that there's patients in the NHS who are waiting 2 years. 2 years for a wheelchair.
I know, it's a disgrace. Don't get me started on the cancer waiting list or the waiting list in general. More than 7 million people waiting for treatment, some of them dying while waiting. That is a disgrace. Let's just remind ourselves of what the Prime Minister said yesterday in the House of Commons about the infected blood scandal and the appalling revelation that some awful, sinister executives, their first instinct was just to cover it up. Let's have a listen to Rishi.
Failure of the state and our medical professionals to recognise the harm caused. This includes the failure of previous payment schemes, the inadequate levels of funding made available, and the failure to recognise hepatitis B victims. And third, to apologise for the institutional refusal to face up to these failings, and worse, to deny and even attempt to cover them up.
Yeah, I like those words. Now act on them. Let's get someone in the dock. Let's get some serious figures. You know, surgeons, doctors, people with knighthoods, people with peerages. Punish them. I'm sick of this.
Yeah.